Hey, and welcome to Unspin Your Mind. In today's video, we'll be talking about how to deal with social anxiety in a post-pandemic world. If you struggle with social anxiety, you're not alone. Social anxiety is a common and treatable condition that affects millions of people around the world. It's marked by excessive self-consciousness, fear of being judged or rejected, and avoidance of social situations. For many people, the pandemic has only exacerbated these feelings. With the shift to virtual interactions and the loss of in-person social connections, it can be especially difficult to navigate social situations in a post-pandemic world. But don't worry, there is hope. Social anxiety is a treatable condition, and there are many strategies and resources available to help you manage it. In this video, we'll explore what social anxiety is, understand its causes, and provide tips and strategies for coping and self-care. So if you're feeling overwhelmed by social anxiety, know that you're not alone and that there is help available. Stick around and let's work together to find the best strategies and support to manage your social anxiety and thrive in a post-pandemic world. What is social anxiety? Social anxiety is a common and treatable condition that affects millions of people around the world. It's defined as a persistent fear of social situations that causes significant distress and interferes with daily functioning. While it's normal to feel nervous or self-conscious in certain social situations, social anxiety goes beyond this and can be much more severe and persistent. People with social anxiety may experience excessive self-consciousness, worry, and fear of being judged or rejected by others. They may also avoid social situations altogether or endure them with extreme distress. Social anxiety can manifest in many different ways, including fear of public speaking, fear of eating or drinking in public, and fear of meeting new people. It's important to note that social anxiety is not the same as shyness. While shyness is a personality trait that may involve discomfort in social situations, social anxiety is a diagnosable disorder that requires treatment. It's also not the same as normal nervousness in social situations, which most people experience from time to time. There are many potential causes of social anxiety, and it's likely a result of a combination of factors. Genetics may play a role, as social anxiety tends to run in families. Life experiences, such as being bullied or experiencing trauma, can also contribute to social anxiety. Environmental factors, such as a culture that emphasizes perfectionism or the pressure to conform, can also play a role. It's important to remember that social anxiety is not a personal flaw or weakness, but rather a result of complex genetic, environmental, and life experiences. With the right treatment and support, it's possible to manage social anxiety and live a fulfilling, meaningful life. If you're struggling with social anxiety, it's important to seek help. A mental health professional, such as a therapist or counselor, can help you understand and manage your social anxiety. There are also support groups available for people with social anxiety, which can provide a sense of community and a safe space to share your experiences and struggles. There are many treatment options available for social anxiety, including cognitive behavioral therapy, CBT, medication, and other evidence-based approaches. It's important to work with a mental health professional to find the treatment that works best for you. Remember, social anxiety is a common and treatable condition. Don't let it hold you back from living your life to the fullest. With the right support and treatment, you can manage your social anxiety and thrive. Seeking help and support. One of the most important things you can do to manage social anxiety is to seek help and support. This may involve seeing a mental health professional, such as a therapist or counselor, or joining a support group with others who have social anxiety. If you're not sure where to start, you can start by talking to your primary care doctor or a trusted friend or family member. They can provide recommendations for mental health professionals or support groups in your area. You can also search online directories or use mental health resources such as the Anxiety and Depression Association of America or the National Institute of Mental Health to find providers and resources in your area. It's important to find a mental health professional who you feel comfortable with and who has experience treating social anxiety. You may want to ask about their training, approach, and success rates with treating social anxiety. If you decide to see a mental health professional, you can expect to discuss your specific fears and the thoughts and behaviors that contribute to them. They may ask you to rate your anxiety levels in different social situations or ask you to keep a journal of your thoughts and behaviors. Based on your specific needs and goals, the mental health professional will recommend a treatment plan, which may include cognitive behavioral therapy, medication, or a combination of approaches. It's important to be open and honest with your mental health professional and to ask any questions you may have about your treatment. In addition to seeing a mental health professional, you may also find it helpful to join a support group with others who have social anxiety. Support groups can provide a sense of community and a safe space to share your experiences and struggles. They can also provide practical tips and strategies for managing social anxiety and support you as you work on your goals. You can find support groups through local mental health agencies, hospitals, or online resources. Some support groups may be in person, while others may be online or over the phone. It's important to remember that seeking help and support is a brave and important step in managing your social anxiety. Don't be afraid to reach out and ask for help, as it's the first step towards living a fulfilling, meaningful life. Coping strategies and self-care. In addition to seeking help and support, there are also self-help strategies you can try on your own to manage your social anxiety. These strategies can be particularly helpful when used in combination with professional treatment, such as cognitive behavioral therapy, CBT, or medication. Here are a few self-help strategies you can try. Deep breathing. Deep breathing is a simple but effective way to relax and calm your mind and body. To practice deep breathing, find a comfortable seated position and place one hand on your chest and the other on your stomach. Take a deep breath in through your nose, filling your lungs and allowing your stomach to expand. Slowly exhale through your mouth, feeling your chest and stomach deflate. Continue this slow, deep breathing for a few minutes, focusing on the sensation of the breath moving in and out of your body. Progressive muscle relaxation. This technique involves tensing and relaxing different muscle groups in your body to help you relax and reduce tension. To practice progressive muscle relaxation, start by tensing the muscles in your feet and ankles for a few seconds, and then slowly releasing the tension and allowing the muscles to relax. Continue this process, moving up your body and tensing and relaxing each muscle group for a few seconds. As you tense and relax each muscle group, focus on the sensation of the tension and relaxation and take deep breaths. Positive self-talk. Negative self-talk is a common feature of social anxiety and can contribute to feelings of self-doubt and fear. To counteract negative self-talk, try replacing negative thoughts with more realistic and positive ones. For example, if you catch yourself thinking, "I'm going to make a fool of myself," try replacing that thought with, "I may make a mistake, but that's okay. Everyone makes mistakes." Exercise and healthy lifestyle habits. Exercise and maintaining a healthy lifestyle can help reduce anxiety and improve overall well-being. Aim for at least 150 minutes of moderate intensity exercise per week, and try to incorporate healthy habits such as eating a balanced diet, getting enough sleep, and managing stress. Set small, achievable goals. When it comes to managing social anxiety, it's important to set small, achievable goals and celebrate your progress along the way. For example, if your goal is to attend a social event, try starting with a small gathering or setting up a virtual meetup with a friend. As you work on your goals and make progress, be sure to congratulate yourself and celebrate your accomplishments. It's important to remember that managing social anxiety is a process, and it may take time to find the strategies and treatment that work best for you. Don't get discouraged and be patient with yourself. With the right support and treatment, you can learn to manage your social anxiety and live a fulfilling, meaningful life. Moving forward in a post-pandemic world, the pandemic has likely exacerbated social anxiety for many people, and returning to in-person interactions may be difficult. If you're feeling overwhelmed by social anxiety in a post-pandemic world, here are a few tips to help you ease back into social situations. Start small. If you're feeling anxious about returning to in-person social interactions, try starting with small, low-stakes situations. For example, you might try meeting up with a small group of friends for a walk, or attending a virtual social event with a few people you feel comfortable with. As you build up your confidence and comfort level, you can gradually increase the size and complexity of the social situations you engage in. Practice in a safe, controlled environment. If you're feeling anxious about returning to social situations, it can be helpful to practice in a safe, controlled environment. For example, you might try role-playing social situations with a trusted friend or family member, or joining a support group where you can practice interacting with others in a supportive and non-judgmental environment. Be patient and understanding with yourself. It's important to be patient and understanding with yourself as you navigate this new phase. Remember that social anxiety is a common and treatable condition, and that it may take time to find the strategies and treatment that work best for you. Don't get discouraged if you have setbacks or struggles, and be sure to congratulate yourself on your progress and accomplishments. Seek additional help if needed. If you're finding it difficult to manage your social anxiety, don't hesitate to seek additional help. A mental health professional, such as a therapist or counselor, can help you develop strategies and coping skills to manage your social anxiety. You may also find it helpful to join a support group with others who have social anxiety, as this can provide a sense of community and a safe space to share your experiences and struggles. Stay connected. While it's important to ease back into in-person social interactions, it's also important to stay connected with others. Even if you're not ready to engage in in-person social activities, you can still stay connected with friends and family through virtual means such as video chat or phone calls. This can provide a sense of support and connection during this challenging time. So let's wrap it up. Remember, it's normal to feel anxious or nervous about returning to in-person social interactions after the pandemic. With the right strategies and support, you can learn to manage your social anxiety and thrive in a post-pandemic world. Thank you for watching. Subscribe and turn on notifications so you don't miss more videos about psychology, your brain, and much more. Check out this playlist of our most popular videos, and I'll see you in the next one. Take care.